We have Dr. Joeimon sir, Hepatology, Assistant Professor, Rajiv Gandhi Government Hospital, discussing Fibroscan, what is new.
So good afternoon to all. The topic now we are going to discuss is what's new in Fibroscan. Fibroscan is a patented product of Ecosense which uses VCTA technology, that is vibration controlled transient elastography measurement, and it is a non-invasive painless procedure which can be completed into 5 to 7 minutes, and it uses two assessment, that is the liver fibrosis and the liver steatosis quantification with KPA and CAP scores. The liver stiffness measurement measures the fibrosis level, while the CAP score measures the steatosis level. And the latest instrument is Fibroscan 630, which embeds in itself ultrasound guidance also, so that it can be used in a precise probe position. And the user and the interface is also interactive with AI integrated, and there are and a dedicated module for splenic stiffness is also enclosed in that. And it uses 3 probes: M probe, S probe, and XL probe. XL probe is of new type, which is probes for the BMI of more than 32, and it quantifies stiffness up to 32 to 75 millimeters of depth. And the S probe is used in pediatrics. It can be used up to 3 months of age also. So the newer quantification of XL probe has given a success rate of 95% and has given a sensitivity of 78%. Why the Fibroscan is used is, it is mostly exclusively non-invasive, and it is samples a 100% larger volume. Before we need to take 10 times. Now it has been given as for one snap itself 10 measurements are given. So it uses real-time results and superior reproducibility. The clinical indications for Fibroscans are viral hepatitis, non-alcoholic fatty liver disease, alcoholic liver disease, and also autoimmune liver conditions. As I told you, the recent advances, the XL probe has been introduced, so that the obesity has no quantification. And the next is the CAP value. It was previously also was there. Now it has been AI generated, so it measures the steatosis level. And to measure the fibrosis, the rule of 4 is used, whereas less than 5 kPa is normal, 9 kPa significant fibrosis, 13 5 kPa signifies severe fibrosis, and more than 17 indicates of cirrhosis. And this Fibroscan can also be used to quantify the prognosis while on treatment. If the value is improving, that means the patient fibrosis or steatosis is improving, and also it can be used to assess the risk for hepatocellular carcinoma and portal hypertension. And the CAP scoring, which is used to know the steatosis. If a CAP score is 238 to 260, that means there is mild steatosis. And if it is 260 to 290, it is moderate steatosis, and more than 290 is severe steatosis. Why it is of a value in NAFLD is, if your steatosis score is more, you can give agents like vitamin E. While if your fibrosis score is more, you have to give antifibrotic agents like saroglitazar or resmetirom, which can reverse the fibrosis. And the newer module, which has been incorporated in the latest Fibroscan, is to measure the splenic stiffness. The measurement of splenic stiffness is now enclosed in the Baveno 6 guidelines also, along with the liver stiffness and platelet value, to know the high risk of significant esophageal varices. If your liver stiffness is cutoff is more than 20, and your splenic stiffness is more than 50, and the platelet count is less than 1.5 lakhs, then it signifies that you have a high risk of recurrent bleeds. If your splenic stiffness is less than 20 and your liver stiffness is normal, that means you are less risk of significant recurrent bleed. This has been incorporated in the latest Baveno 6 classification guidelines to know for high risk of bleeds. The limitations of Fibroscans presently are there can be false positive when there is acute inflammations. Acute hepatitis or ACLF, acute and chronic liver failure, acute liver failure, it can give a false positive value. And gross ascites is also a limitation, and there is a significant regional, and for example for the Western or Indian, there is no separate guidelines as of now. So it encloses a universal guidelines. So all these are the current limitations of Fibroscan. And the emerging technologies complementing Fibroscans that have been used are RF score, which uses the ultrasound technology, then the MRI elastography, and the AI integration along with that. So on the takeaway, Fibroscan is a validated non-invasive tool, and recent advances like Excel probe, capillary and splenic stiffness has increased the usage of Fibroscan in liver cirrhosis, and the introduction of AI and easy to use with user interdependence are much useful in it. And Fibroscan is now also used as a research advancement in direction of early massivity even in adolescents. Even in Government of India, they are planning to enclose along in the school program, health program, to diagnose high risk with FIB4 score, and if the FIB4 score is high risk, then the patient is sent to a Fibroscan area where they do a Fibroscan to know the risk of fibrosis and steatosis. Thank you.
Thank you so for that very enlightening talk. I just had a question for you. So this Fibroscan has been standardized for men and women separately, or the values are the same? That's one question. The second one is, what about pregnant women and fatty liver? Do you have to change the probe for them?
Value is the same for men and women. There is no changes in the value. And as per latest guidelines, Fibroscan is safe in pregnancy because it is localized and that's it works, so it is safe in pregnancy as per latest guidelines.
So, we had one patient actually. Fibroscan showed around 10 or something, 10, 13, which was significant fibrosis. But that patient happened to have undergone some surgery, so liver biopsy was taken that time. It showed only steatosis, not fibrosis. So
first what you use ultrasound to get throughout because Fibroscan machine, which Fibroscan machine we use is make also different. So before machine we have to take 10 different areas. So that patient might have been given only one area which has a steatotic, and they would have left the other areas. So it takes a median value only.
Fibrosis value vary in different segments, ma'am. Like the depth of penetration of Fibroscan, like as mentioned, like it has limitation. But ARFI, they can focus wherever they want, they can measure the fibrosis. But the depth is fixed with the Fibroscan. So like some distance only they can measure, and some point only measure. Some segments only they usually take. So like if the fibrosis is uniform, then you will get the results. Like otherwise, it may be not the representation of the entire liver actually.
ARFI and Fibroscan are almost like same.
Different Fibroscan is very much validated. ARFI is like another thing. Like ARFI can be done even in ascetic patients, but Fibroscan cannot be done in ascites patient. And obese patients, ARFI can be done, but Fibroscan it won't even detect the liver, ma'am, actually. So like these are the something, and ARFI they can whatever the depth they can select, they can measure the Fibroscan. And ARFI also used to, like whether it's a HCC, like there are also there is some studies showing like ARFI to the stiffness of the lesion, that they can early identification of HCC are also there.
Okay, sir.
So when we should not do a Fibroscan? Any day, is there any contraindication for a Fibroscan?
No contraindication. It is false positive.
No, food intake, like empty stomach, fasting state should be there.
Severe hepatitis, severe alcohol intoxicity, severe.
Not
Yeah, that's all. In Bacchiari, acute transaminases, acute drug-induced liver injury, everything will there will be a high number that is false positive. That's it.
Like
Should be
any
avoided.
inflammatory conditions.
Yeah,
like
that should be avoided. Yeah, sure. Fine.
Any other questions from the dialogue? Thank you, sir.